Okay, so we're going to be also doing a chest tube dressing change now. So I'm going to first wash my hands, and I'm walking to my patient's room. Hi, my name is Brianna Johnson. I'm going to be your student nurse today. I just confirmed with your doctor's orders, and it's time to be changing your chest tube dressing there. So what we're going to be doing is we're going to be taking off the old dressing. I'm going to do a quick check to make sure everything's working okay, and then we'll get it reattached with a new dressing just to make sure that everything's stabilized and great. Do you have any other questions? Patient has no questions. So I'm going to start off by coming around and making sure that it is set up to a low continuous suction. So it would normally be on in the green low area in there, but just for demo purposes to maintain the sound quality, I'm going to turn it off right now, but I would be making sure that it was on low continuous. And then I'm going to follow my line through, noting, making sure that there are no kinks, that it is attached to the truss tube. I can see it under there, so it's all good and working fine. And while I'm over here as well, I'm going to note that we have our forceps clamps, which is good what we need, as well as we have our normal saline and our sterile water, which is great. So then I'm going to come back around. I'm just going to let you know I'm going to lift the head of your bed here, just to make sure that you're in a comfortable position for that change. So we're going to be doing that at a 45-degree angle. I'm going to lift the bed in general just so that it's more comfortable for both of us and that we're keeping sterility. Okay, so that's good. I'm going to continue on my check for my box, my Plurivac box. So I'm just noting that I followed that line through all the way. I'm noting that I can see the orange ball showing that I do have suction. My suction is set to 20 as per ordered by the MD. I'm noting that I have my 20 mLs of fluid in my water chamber and that there's no crazy titling indicating that there's an air leak. So that's good. I'm noting that there's a little bit of titling going with my patient's breathing, which is normal and to be expected. I'm also going to be noting any drainage, which it looks like they have 300 mLs of serosanguinous fluid. I'm going to make sure to sign, date, and time for that at the beginning of my shift so we can monitor how much drainage they are having. And I'm also going to document the findings of what the drainage looks like and how much there is so that we can keep the eye on that. I'm also then going to look in the chest tube part. I'm noticing that there's no clamps, there's no dependent loops, there's no kinks. It looks like it's draining properly, and that's all good. So we are good to begin. So I'm just going to inform my patient that I'm going to have to remove this blanket. They have no problems with that. I'm also going to ask them if they could lift their arm, which they are more than compliant to do. I'm going to move this gown. I normally would try and maintain as much dignity of the patient as I possibly could, but for demo purposes, so that you guys can see what I'm doing, I'm really going to expose it so that we're able to see everything that is happening. So my patient feels comfortable in that position. We have them covered, and I'm going to pull over my tray here. And we're going to begin. So I'm going to wash my hands, and I'm going to open up my tray here.
We also have our suction catheters to the side, and they are a size 10 French, which is the size of the big is a 7, so 7 minus 2, 5 times 10, so that's the correct size. So we've done our full safety check. I'm just going to quickly make my patient and
we have our empty bag here.
so we're going to turn up the
Patient
all
can
the
be
way
on
up.
so they don't need that.
I'm going to pass myself my sterile garbage bag, asking my patient if they are okay with me putting it here, and they have no issues with that.
And it is at 100% now. We can take off
Also, this would never have been used before. I'm just going to leave it. There's a hair in there, but it would not have been there. Just so you know. This would be a new kit, and if there was a hair, I would not use this kit. Okay. So then, I'm going to add my normal saline, making sure that it doesn't spill. And that is good. I'm going to set that aside. I'm going to sterilely open up my jelonet, which would be closed.
But if the patient is sat, I would connect all the way there, and the patient will take a deep breath, and I can check the ultrasound monitor. So looking at the ultrasound monitor, if the left side of the percent are good to proceed. Okay, so now you can section 1. So we have our 2-way already set up at the ring.
I'm also going to open up my door switch, which would also originally be closed.
We're still at 9 UV, so And then we're going to be attaching.
I'm gonna go in. I hit the bifurcation.
We're
I'm
going to be
gonna insert my
attaching the
section and rotate.
And popping that aside. So that is all great.
Disconnect this. This is
So
going
next,
into the garbage.
and we want to be
making sure not to turn my back to my tray here, I'm going to pop on,
Quickly put in these gloves. After I put it in some
pop on my
now we're
clean gloves,
We're also monitoring
and I'm going to remove the dressing. So I'm noting now, looking at this dressing, that it's not looking, there's no shadowing, it's looking intact, but it is just time that it's been ordered to be changed. Okay, so I'm going to remove this. I'm telling my patient just to let me know if they're experiencing any pain, and they're feeling okay with this.
set this aside.
We want to hold that. You don't want to
I'm going to make sure when I'm moving this off
I'm just
that
gonna
I
put
am
the O2 back on my patient.
stabilizing this chest tube into place.
And we'll treat this
And it is all stabilized, and that is good. I'm going to throw away the old dressing, and I'm going to grab,
we're gonna take off the old.
I'm going to take off these gloves. I'm going to grab
This we're gonna use
some new gloves, wash my hands,
again. I put the O2 monitor the O2
put on my new gloves,
but I'm just gonna pre-oxygenate them again just to be sure. Can I get you to take 2 to 3 deep breaths?
and then we're going to remove the old jelonet.
It's still at 100%. They have not saturated, so we can take off
I'm
the
going
mask.
to remove this.
I'm gonna stabilize the flange as I take off the
Off, and I'm just going to take those forceps. I'm then going to remove my old gloves, wash my hands, noting that that chest tube is being held onto the bed. It's being stabilized there, and that it is not moving. I'm going to take a look around the site, noting that it is all clean. There's no redness or erythema, no pus, no drainage around the site, and that is looking good. But we'll continue to monitor that as we clean. Okay, so now at this point, I'm going to pass myself
and I'm gonna go in with
my sterile drape,
And then I'm going to do my background because we have to keep wearing gloves.
only touching
We're also protecting
the
our
borders. And at this point, I would ask my patient to roll over onto their side a little bit more to try and keep this as sterile as possible, so that I'm not touching, but I'm just going to try and keep my hands to the side as much as possible to keep that as a sterile field for myself. Okay,
have our cannula here, so in reality this would actually be closed, not open. So this is the right size.
so
So
I'm going to move this over.
and we're going to be removing it. So make sure to stabilize.
This would not be
the-
here, I just have to, I'm so sorry.
You don't want to pull the tube out.
Goodness.
So gently pull it out.
This would not happen because this is a reused kit. Oh my gosh, thank you.
And I'm just gonna put down my imaginary trash can.
So,
Hygiene. And then new gloves. So now we're gonna change the cannula.
I'm just gonna open it.
and
Is it okay if I
I'm
just
going
put
to
the
do a
garbage on
half moon swipe.
So this is also a sterile technique, so be very careful when you're opening it. You just want to touch the ring, so just make sure that my gloves aren't finicky here. So just touch the ring and be very careful. And you just want to try and touch the ring. And then you're going to go in and
I'm going to do another half moon
add some swabs.
underneath.
This is not gonna be sterile. We're just going garbage.
twist the ring. In reality,
A bigger circle.
we have a
We're gonna add some green
mannequin
sponges into our.
but it's in now. In reality, we would want to go ahead and angle and then do a twist down, but it's in. And now, my gloves are so clean, so I'm going to be changing the, I'm just going to be removing the old dressing. So,
Ensuring that this is not
stabilize
expired.
that, not to.
In 11 minutes. Okay. So no splash. Good to
Okay,
go.
so then now our gloves are dirty, so then
Take off the old.
now, we're going to do hand hygiene.
Put on a new set of clean gloves
And
take off
going underneath
dressing.
on
We
that
still have the
bigger
O2 on the
circle.
patient. So again, we're gonna pre-oxygenate them for about 30 seconds.
Okay.
Asking them to take
And then I'm going to do a 4x4.
and we can take off the mask. To the side, I'm going to make sure that I'm not taking the stomach part, and I am going
To get a nice big surface area.
the old dressing. I'm noting what's on the old dressing is dry and intact. That's what also is going to be on my documentation. I'm also just taking a look
For this,
at the
I'm going to do
stoma.
a nice big one swipe
There is no
circle,
infection, no redness, no swelling,
all the way
and
around,
all at your
and disposing of that.
okay.
So that is good. it is all cleaned, it's looking clean, the site's looking healthy, and I'm going to dry.
Tip to tip. Be very careful.
So, keeping my back not to my face, I'm going to do a full circle dry.
Okay, I'm gonna take my swab. I'm gonna put it into the ceiling, and I'm just gonna lift the plant a little bit to make sure I get the stoma. So there, cleanest to dirtiest. And then we'll go underneath, cleanest to dirtiest around the stoma. Okay. Then we'll go a little bit around the
We're gonna do another
stoma just
fuller
so we get
circle
everything
dry.
that's underneath the dressing. Just gonna lift a little bit and then flip around.
And then we're gonna do another one of those 4x4s to dry.
Around the stoma here. And now we're gonna dry with a 2x2.
So right now we're just gonna just use those right now.
So I'm gonna take a 2x2. We're gonna make a rosette. You're really careful.
So now we're going to clean it.
So
We're
good.
gonna lift.
Start it right underneath.
And I'm gonna make
Full circle dry to make sure that that whole area is clean. So that's good.
So,
So then, at this point, that is all dry. I'm looking at the site, it's looking healthy, everything's looking good. I'm going to
go from the
open up
back one.
my jelonet.
We're drying.
Actually, you know what though, before I do that,
We don't want any kinds of ulceration of the skin or damage.
we're just gonna change our gloves,
We're now gonna put on the
making sure that we are keeping this as sterile as
only
possible.
part of this that needs to be sterile will be the inner portion that is touching the stoma. Gonna go underneath.
Okay.
Now we're gonna dry.
Side,
So
making sure that that middle portion
Let's try and open up this
Okay,
jelonet
I'm
here.
gonna set my forceps down and I'm gonna use my hands just to touch the edges and to fix the dressing. Other side as well.
and then we're gonna be using 2x2s to dry the bottom.
That hit the bottom part, the outside border, so it's okay, and it was sterile, it hadn't touched anything else, so that's okay. I'm going to roll up my jelonet.
So I'm just gonna change that. I don't want to risk contamination. And do that again.
And we can bring this over to the patient. So
I'm gonna put the O2 back on.
I'm going to make sure that it's only touching the places that we've
You can
cleaned.
assess the
Is
stoma.
that
So the
has
stoma
been
Make sure that it is, I think,
there's
correct level.
infection, there's no feeling, there's no odor.
So I'm gonna turn it back down to 40.
There's also no
Making
redness.
sure that it is all inclusive.
So it's
So now
still
we
at
can
the
put on the
correct
new
one.
dressing.
And
Actually,
just gonna make sure that my patient is not in
I'm
any
going
distress
to
when I leave,
remove
put
that.
them down
And I'm going to clean the tube.
all the way.
And I'm going to ask my buddy nurse to bring me a fresh jelonet.
And
Let's not try to stick because that's
and washing my hands. And doing
Oh no.
Yes.
Oh my gosh. Okay, so she brought me a fresh jelonet. We've opened that into the kit, and I'm actually going to clean
And
the
then now we
tube
will
here.
clean everything
So
up.
going down.
Put the patient oxygen back on. So Tyson is gonna make sure that on the back here, and then just put the oxygen back on. Make sure the patient's really office. Make sure the oxygen is on and it's at the right oxygenation. So we're just gonna check on and it's at the 10 meters. It's just
And that's
equal
good.
to the
So now
60%.
we are good. I don't have to dry that because it will dry on its own. I am going to
So I'm tasting your
get that
nutrition
jelonet
is now done. How are you tolerating
and
that? Tolerating well?
roll this up.
So I will just make sure that the O2 is not more like what does not go down as much. So
We are
we'll
going
send it
to
from 97%.
Make sure this is nice and tight.
So Tyson, oops, just gonna make sure that's all tight. You wouldn't want to leave without the oxygen.
Okay. And now I am going to put this all the way around, making sure that it's only touching the sites that have been cleaned. So that is all good. I'm noting and I'm getting it all the way around so it's fully inclusive.
So the same college position easier.
and it's all the way around. So that's great. I'm then going to grab
Then I'm gonna do
a 4x4 here.
Stress no hazards that call out is within reach. And
Just kidding, I'm gonna grab my drain sponge. I was testing you.
comfortable, they're safe.
Alright, we're gonna grab that drain sponge.
All the basic equipment here is still intact, and
I'm going to pop that on top.
And get ready from here. Okay, so then
Making sure that it is all fully occlusive.
gloves, do hand hygiene.
I'm going to grab the other one.
Document on it and the procedure. So what I use to clean, for the patient tolerated it, and also
Noting that it's only touching the spots that are
and also the characteristics of the wound drainage. I would also note down.
so that that is okay.
My plans for future dressing.
I'm going to adjust it to make sure that it's all fully occlusive and that that area is all nice and sealed. That's good. At this point, I'm going to grab my 4x4. I'm going to place that on top. I'm going to set these aside. And I'm going to grab my mefix. Making sure not to touch the inside. Not needing this anymore, so I'm just going to put this underneath. And to the top. Not touching the inside.
If you're able to run through the pressure, it's all
Making sure not to touch the inside.
3 minutes.
That over top. This again, making sure that it stays completely occlusive. I'm going to make sure that we are tenting so that this chest tube is not moving on the patient if they're moving around. So tenting that in there and making sure that it is stabilized down. And then I'm just noticing a little spot there that I want to make sure is totally covered to make sure this dressing is all occlusive. So I'm just going to pop that right there. Okay, so my chest tube is tented, it's all occlusive, it's looking good, it's not moving, my chest tube is still in place. I'm going to clean up all my supplies, making sure that my patient is still feeling okay. I'm going to document that that procedure was done, that they didn't have any distress, that they tolerated it well. I'm going to document about the site, and that there were no concerns there. I'm going to get them to put their arm back down, making sure they're comfortable. I am going to leave them in a sitting up position, but I will put their bed in the lowest position. I'm going to make sure that that call bell is within reach, again confirming that that suction is on and that my box is below the patient's insertion site and that it is draining okay. And it's looking good, there are no kinks or dependent loops, my patient is comfortable, they have the call bell, they know to call me if they're feeling any pain or any difficulty breathing, anything like that. I'm going to make sure that everything is good, the patient isn't in any distress. Bed is lowest, bed is all in place, I've collected all my supplies, and I'm going to leave.